Welcome to my channel. Today topic: what to know about the vegetarian diet. People following a vegetarian diet do not eat meat or fish but may continue to eat eggs and dairy products. A person does not have to eat meat to get all the nutrients they need for good health. A meat-free diet can lead to better health for several reasons. One reason is that many people who follow a vegetarian diet tend to consume a high proportion of fresh, healthful, plant-based foods, which provide antioxidants and fiber. When a person decides to follow a meat-free diet, they often become more active in making overall healthy choices. What foods do vegetarians eat? A vegetarian diet can provide a wide variety of healthful, nutritious foods, but what the person eats will depend on the type of diet they are following and their personal food choices. There is a variety of diets that come under the umbrella term vegetarian. Lacto-ovo vegetarians avoid both meat and fish but consume dairy and eggs. Lacto-vegetarians consume dairy products but no eggs. Ovo-vegetarians consume eggs but no dairy. Some people who do not eat meat will eat fish. This is a pescatarian diet, rather than a vegetarian diet. A vegan diet excludes all animal-based foods. People following a vegetarian diet must make careful choices about what they eat to ensure that they meet their nutritional requirements. Some people may need supplements. Benefits: a growing number of younger people are adopting a vegetarian diet, as the Gallup poll shows. They may do this because it brings health benefits. It is a more ecologically sustainable option. They have concerns about the treatment of animals. It is part of a broader lifestyle choice. Some people also avoid meat and animal products for religious reasons. Here are some ways in which avoiding meat products can enhance a person's health. Weight: switching to a vegetarian diet may help a person lose weight, at least in the short term, according to a 2016 meta-analysis. Scientists need to carry out longer-term controlled studies to understand how a vegetarian diet might affect weight. Cholesterol: a systematic review published in 2015 concluded that people who follow a vegetarian diet are likely to have lower overall cholesterol levels. Cancer: a study of data for nearly 70,000 people found evidence that the incidence of cancer overall was lower among vegetarians than non-vegetarians. The authors suggested that a non-meat diet may offer some protection from cancer. Heart health: authors of a 2014 study found a lower risk of cardiovascular disease in people who followed a vegetarian diet in India. Studies in Western countries had already produced similar results. Diabetes: people who follow a vegetarian diet may be less likely to have type 2 diabetes. One reason for this may be a higher intake of whole grains, fruits, vegetables, legumes, and nuts, and a lower intake of unhealthful fats. These benefits will not automatically happen when a person stops eating meat. Alongside a vegetarian diet, people need to make sure they get the right number of calories, focus on a variety of fruits, vegetables, and whole grains, limit their intake of processed foods and alcohol, avoid unhealthful fats and added sugar and salt, engage in an overall healthful lifestyle, with plenty of exercise, avoid smoking. What are the health benefits of a vegan diet? Sustainability: in addition to the health benefits, experts say a plant-based diet is more sustainable, as it causes less harm to the environment than a meat-based diet. Tips for getting started: here are some tips for switching to a vegetarian diet. Start learning about the nutrients required and how to obtain them. Get some tips and recipes from vegetarian websites, a local health food shop, or a nutritionist. Make a weekly shopping and meal plan. Focus on a variety of meat-free dishes that provide a complete protein, so that you do not end up eating as before but just leaving out the meat. Consider making the change gradually, for example, over a month. Start with familiar meat-free foods, such as mac and cheese and salad, and add to your repertoire over time. A gradual change may work better for two reasons: it is more likely to become a lifestyle and a long-term move. Sudden dietary changes, such as an increase in the consumption of beans or vegetables, might lead to temporary digestive problems, such as bloating. The Academy of Nutrition and Dietetics have a range of tips for people who want to stop eating meat. Choose whole grain products, such as whole wheat bread, wild or brown rice, and whole grain cereals, as these can provide B vitamins. Vary the diet, with whole grains, fruits, vegetables, legumes, nuts, and so on. Use eggs and dairy products in moderation, or try adding soy milk. Ask a healthcare professional about supplements, especially vitamin B12. Ensure a sufficient intake of vitamin D, especially if exposure to sunlight is low. Check the labels of healthful vegetarian snacks to ensure they do not contain a lot of sugar, salt, or other additives. Remember that junk food and fast food can be unhealthful and high in calories, whether they are vegetarian or not. They also suggest reducing the intake of high sugar and high fat foods. Thanks for watching. Subscribe for more videos.